Abnormal cells grow out of control and form tumors. And there are different categories. And these cells are actually, they categorize or describe the types of breast cancers. There are very many different types of breast cancer. Mostly there are two major breast cancer types, and that is invasive breast cancer and non-invasive breast cancer. Then the non-invasive breast cancer are the ductal carcinoma in situ, lobular carcinoma in situ. The invasive ones, we have invasive ductal carcinoma and invasive lobular carcinoma. Then the others, we have inflammatory breast cancer, triple-negative breast cancer, metastatic breast cancer during pregnancy, Paget's disease of the breast, which is a breast cancer, a form of breast cancer that is actually evolved because of where the cells collect, especially in the nipple or around the nipple. What do we mean when we say in situ? The earliest stages of cancers are called carcinoma in situ. Let me mention that this is a non-invasive cancer. It's also called a carcinoma in situ. It means cancer is in its original place. So more explanation on those different breast cancer types. The invasive breast cancer, it means that it has spread into the surrounding breast tissue. And the non-invasive, it means that the abnormal growth of cells are still within the part where it was. Like you can see on this part, we have the lobules and the ducts. So we are going to look at the anatomy of the breast so that we can be able to fully understand anatomy and physiology of the breast, of the normal breast. As you can see, a breast tissue is located on the anterior chest wall, so in front of the rib cage. So you can see it is composed of a fatty tissue. It has a lobe or lobes or lobules. Then we have the areola, the nipple, as the external part. So you can also see internally we have the rib cage behind, whereby there are also organs behind the breast, and this includes the heart and the lungs, or the airway. Then we also have the oesophagus in the middle of the two breasts, or the mediastinum. The other side, we can see the lymph nodes. These are very important structures for the breast. And when we are looking at examination of the breast, these are also going to be very important and relevant. The lymph nodes run from the pupil to the neck and to the axilla, and then run downward, and this is called the brow line. So you can see we have a subclavian joint with a subclavian lymph node. So when we talk about the clavia, we are talking about the clavicle. So the clavicle has the lymph nodes that are covered here, the supraclavicle and infraclavicle. So above the clavicle bone, we have the supraclavicle lymph node and the supraclavicular lymph node. The main exposed or have a risk of developing breast cancer. Having a denser breast is another risk factor of developing breast cancer. Then let us look at the changeable risk factors according to Centers for Disease Control. Not being physically active. The sedentary lifestyle is a very serious risk of predisposing women to breast cancer. Hormonal factors, women who are taking hormonal therapy or contraceptives that have extra hormones, especially estrogens, stand a very high risk of developing breast cancer. Exposure to radiation. Why is this indicated here as a changeable factor? Because there are people who work in radiation centers, especially those who work in hospitals or other places where there is increased radiation exposure. Overweight and obesity. As you know very well, being obese and overweight predisposes one to not only breast cancer but also other cancers. Reproductive history. Having a pregnancy, the first pregnancy, after the age of 30, full-term pregnancy can raise a risk of breast cancer. This is because of not putting the breast tissue to its original use or the intended use, and that is breastfeeding. Alcohol consumption and nicotine abuse. Women who consume alcohol or women who smoke cigarettes stand a very high risk of developing breast cancer compared to those who don't have this lifestyle. Let us take a look at breast self-examination. We have already described what self-breast examination is, but let's go into details and look at breast self-examination in detail. Breast self-examination as a screening method for breast cancer. This can help. Breast self-examination aims to help women understand their breast topography, typical breast sensations, and also detect potential alterations or changes. Breast self-examination should complement mammography and clinical examination, not replace it. So which means breast self-examination is not the only way to screen for breast cancer, but rather there are others. In Uganda currently, the gold standard for screening for breast cancer, or globally, is mammography. And clinical breast examination are also very necessary, whereby a woman has to visit a healthcare provider to perform a breast self-examination. Clinical breast examinations also include ultrasound scans or biopsies or other methods that intend to detect or screen for breast cancer. What do we need as equipment for performing a breast self-examination? First of all, you need a mirror, you need a bed where to lie on, so you can lie. That can be a bed or a mattress or a sofa or a mattress on the floor or whatever works for you, or even in the bath or in the shower. You need your hands and you need your eyes. So it is also very important for women to have very short nails so that this can enable them to touch their breasts conveniently and comfortably. Sight is very important. If one has a sight problem or visual issues, then proceed for clinical breast examination with their healthcare provider or their doctor. or BSE. There are two major components here. The first major component is inspection. Inspection means you're looking with your own eye, preferably in a standing position or a sitting position. The second step, or the other major component, is palpation. This can be done while lying down or even standing up. So these are some of the steps that we are going to look at in detail. First of all, in inspection, when you stand in the mirror, look at your breast in the mirror with your shoulders straight and your arms down. That is the first picture here. You should look out for breasts that are in this position. You can look at the size, the shape, and the color. Then breasts can be evenly shaped without any visible distortion or swelling. So this is the first step we've talked about. So this is how the posture should look when you stand in the mirror, when you sit comfortably. When you sit comfortably, when the arms are at the side. Then the other thing you can do is to put your arms over your head so that you can look and inspect on the movement and the position of the breast and the nipples. Then you can press the hands and then your hips. So this is how it should look like. The other way is to lean forward. When leaning forward, you can look at the way the breasts are actually hanging. If you can see one breast heavier than the other, or one which is heavier than the other, or any changes in the size, it can be easily identified in this position in inspection. We have seen that there are three maneuvers presented above, and then this can lead to the contraction of the pectoral muscles. The pectoral muscles, those are muscles that cover the chest. If the breasts are large or pendulous, it may be useful to stand or lean forward, supported by the back of your chair. Inspect the breast contours carefully in each position. Step 1, still with inspection. What are the possible findings? Breasts are symmetrical in size, shape, and there are no prominent pores. The breast can be a variety of sizes and are somehow round and pendulous. One breast may be normally larger than the other. If your dominant hand is the left, then you find that your left breast is a bit larger than the right. That's normal. The annulars vary from dark pink to dark brown, depending on your color skin tone. They are round and may vary in size, and we will also see the Montgomery tubercles present on the nipples. The Montgomery tubercles are those openings around the nipple, or they look like goosebumps on the nipple. The nipples they are nearly equal bilateral in size and are in the same location on each breast. Nipples are usually everted, meaning they are outward, but they may be inverted or tending to move inward, or they can be flat. No discharges should be present after you have done your inspection. You should not see any visible discharges. Those are the normal findings during inspection. What are the abnormal findings during inspection? There could be edema of the skin. Edema of the skin is produced by lymphatic blockage. It appears as a thick skin with large pores. It is also known as peau d'orange. This is a French word which means a peel of an orange. And this is a bad sign. It is usually seen mostly in the first lower portion of the breast or even the areola. The suspicious findings that you can see during inspection. Apart from the peau d'orange or the orange-like skin, there can be also redness of the local inspection. The local infection or inflammatory carcinoma. So the inflammatory kind of carcinoma will cause redness or darkening of the skin in women who have hyperpigmented or pigmented women or women of color or black women. Pink skin-like or orange peel appearance results from edema, like we have seen. And this can be seen in metastatic breast disease. A metastatic breast cancer is one that has saturated or affected, the cancer has affected other organs apart from the breast. A prominent venous pattern may occur as a result of increased saturation due to the malignancy. So when you look at observe the blood vessels of the breast, they are very prominent. They can also be prominent during pregnancy. But if they are very prominent in a non-pregnant woman, this can be also a sign that this is increased saturation due to malignancy or due to breast cancer. Asymmetric venous pattern may be due to malignancy as well. During inspection, some of the abnormal findings could be abnormal contours. You look for any variation in the normal convexity of each breast and compare one side with the other. Spatial positioning may again be useful, as shown here. You can see a flattening of the lower part of the lower outer quadrant of the left breast. The other, like we mentioned that there is also Paget's disease, which is another form of breast cancer. This form of breast cancer affects the nipple. It's an uncommon form of breast cancer that usually starts as a scaly eczema-like lesion, and the skin may also weep or crust or even erode. The breast mass may be present. You have to suspect Paget's disease in any persisting dermatitis of the nipple and the areola. The other abnormal finding is nipple retraction and deviation. A retracted nipple is flattened or pulled inward, as illustrated here in this picture. So the other abnormal findings we've mentioned inflammatory breast cancer, where there is increased redness or darkening of the skin color, like you can see in this picture. Other findings we have finished all our findings during inspection. Now let us take a part and let's take a look at the palpation part, which is step 2. We have looked at step 1. We looked at the different steps you can take during inspection and the different findings, the normal findings and the abnormal findings. And now we are looking at the second part or the second step of breast self-examination. Step 2 includes palpation. You have to stand and press your 3 middle fingers to your breast, walking around the breast in a circular form, using your right hand or your dominant hand, depending on which one you want to begin with. If you're using your right hand, you're going to palpate palpate your left breast. If you're using your left hand, you're going to palpate your left breast. Use a firm, smooth touch with the finger pads, not the tip of the fingers, but rather your finger pads, keeping the fingers flat together. Using a circular motion about the size of a 1 cent coin or a 100 shilling coin according to Uganda shillings, or a 500 coin according to Uganda shillings. Follow a pattern to be sure that you cover the whole breast. You can begin at the outer edge of the breast, moving in smaller circles until you reach the nipple, like you can see in this illustration in the photo or the picture. The third step in the palpation technique: squeeze your nipple to check for discharge. This could be a watery milk or yellow fluid or blood, depending on whether the woman is pregnant or you are pregnant or not, or breastfeeding. So you have to put this into consideration. In case of bloody discharge, you have to see the doctor immediately. But normally, in some recommendations, the nipple examination is done at the end or as the 5th step. But it can be done at any stages. Step 4 of the palpation technique, you feel your breast while lying down. So here you are required to lie down. You place a pillow to make yourself comfortable beneath your shoulders. As you can see in the picture, this helps your breast tissue spread evenly across your chest wall. And now here you're required to repeat step 2 and step 3. In this position is also known as the supine position. The breast tissue is flattened and easy to examine. A thorough examination will take around 3 minutes for each breast. So you need around 10 minutes for the breast self-examination. Use the finger pads of the second, third, and fourth fingers, keeping the fingers slightly flexed. It is important also to be very symmetric. Like you see here, according to the eyebrows, you can start from the maxilla point up and about to make sure that you complete the entire breast and the surrounding areas. These are the techniques that can be utilized. You can use any of these. You can use the circles, you can use the wedges and the line, whatever you prefer. The circular one or the clockwise one, then we'll have the wedge and also the vertical three. And you have to be consistent and thorough with the method you choose. Start at one point for palpation and move systematically to the end point to ensure that all the breast surfaces are assessed. Step number 5, you have finally reached this step. You've done everything, now you're going to take a shower. It is recommendable that you start the breast self-examination before you go for a shower. Then you end the entire exam in the shower because it is easier to feel your breast and the skin when it is wet and slippery with soap. Cover the entire breast using the same hand movement described in step 2 and step 3. Let us look at checking the lymph nodes. Like we said, the lymph nodes are very important. Breast cancer can cause changes in the lymph nodes in the early stages. To check the lymph nodes, look for a lump, a swelling or thickening of the underarm, which we call the axilla. A lump or swelling in the forearm area also very important because we mentioned that this supraclavicular and infraclavicular line just above and below the clavicle. Those lymph nodes have to be palpated. If there is any changes or swelling around this area, it can be suspicious of breast cancer. A thickening of the skin in the armpit is also very suspicious. So these are our lymph nodes, as we mentioned earlier, and those are the areas you're going to palpate. We've already discussed about the normal findings during inspection, but during palpation, the normal findings, you're going to, there will be no swelling, there is no pain, no discomfort experienced, and the breast tissue is not going to, you're not going to feel any of these abnormalities in the breast tissue and the surrounding areas. There will be no palpable masses or lumps. So the entire breast self-exam uses a methodical approach as we walk around the breast to avoid missing any areas. This pattern should extend from the lateral border of the sternum to ribs, around the rib 2 and the rib 6, then covering the whole body of the breast. Ensure that the physical examination reaches from the upper outer quadrant to the axilla, including the axillary tile space or tile of glandular tissue. The three most typical inspection patterns are concentric circles spiraling out of the nipple wedges, radiating out of the nipple, and the lines forming a grid encompassing the whole breast, like we saw earlier in our photos. The pattern still has no effect on the exam and is utilized just to guarantee a systematic coverage of all the breast tissue without leaving any regions out. So these are the other steps that we have looked at, and these are the conclusions. You see, the conclusion, you're ending up with the lymph nodes under the arm, on the clavicle, as we mentioned. This is a summary of what we've been talking about in a pictorial form. Those are the abnormal findings during inspection. We've already discussed this. You see nipples turning inward, and these are the cancer signs, breast cancer signs. The nipple discharge, the lump in the underarm area, or a lump or a swelling in the breast, breast nipple pain or skin irritation or redness of the skin, like we said in inflammatory breast cancer. You see the skin changing color to red or even more dark, if dark with that. The skin dimpling in terms of contour, or we looked at them during our explanation of the steps of pregnancy spread. What are the benefits of performing the breast self-examination? We earlier mentioned that this can help identify changes in the breast and get early intervention or treatment. Because when breast cancer is detected early, there are very higher chances of survival or even getting cured of breast cancer, especially if it's stage 1. It enhances awareness of one's breast body, and it also encourages regular health checkups. It increases personalized health monitoring and also enhances the understanding of body changes of women. It establishes a health-conscious mindset and encouraging open communication about breast health. lamb in your house. You have to calm down. If you discover a lamb, make an appointment with your doctor or you go to the hospital. At Makerere University, there is a university hospital where you can get help anytime you come in. Talk to the doctor available and they will make arrangements for you for further checkups, investigations, and care. Don't worry, because 8 out of 10 bumps are not malignant. Some of these bumps can be benign and they are not cancerous. For added peace of mind, contact your doctor anytime you have any concerns. What is the best time that is recommended for breast self-examination? Frequency. It is advisable that women perform breast examination once every month. For women who are menstruating and having regular cycles, should have a target of performing breast examination about the 7th or 10th day of their cycle, or after their cycle on the 7th day or 10th day. Between those days, and those who are not having a regular cycle, or those who are not menstruating, like women who are in postmenopause, in menopause, they can have their breast checked every month according to the calendar they set up. So they can set up a calendar or somewhere in the phone for a reminder every month to perform a breast self-examination. Then after breastfeeding, to face breastfeeding engorgement. So this can be performed by women who have completed their breastfeeding. But during breastfeeding, it can also bring engorgement and discomfort. That's why it's advisable for women to perform breast self-examination after breastfeeding when there is no more milk in your breasts. If you have any questions, feel free to ask. These are some of the references, and thank you very much for your attention. We have concluded the end of our presentation.
Recording stopped.
Grace, for that good presentation. So now questions are
Are there
welcome.
any questions so far?
Questions are welcome. It's question time. There is a question here. Grace, there is a question. Hope you'll be able to hear. Which one is malignant? Thank you. I would love to. Okay, maybe Grace can answer those questions as other people prepare more questions. Dr. Harriet, can you maybe repeat the questions for Grace?
Yes, please.
Second last question was by her.
My question breast eczema, do they have high chances of getting breast cancer?
People with eczema, breast eczema, do they have a high chance of getting, high risk of getting breast cancer? So I think, Grace, you answer those questions as others prepare to ask other questions.
If that's right, she was having eczema.
Grace, the people who are dealing with the catering wanted us
I'm going to be requesting that you open.
Grace, can you hold them?
Well, muted, I can't hear anyone.
Oh, sorry.
Unfortunately.
Sorry. Can you hear us now? Can you hear us? Grace, can you hear us? We were unmuted. Grace, can you hear?
Yes, I can now hear you.
Okay, so there was a study.
Predisposes one to get cancer.
Grace, just a minute. We need to resolve something. The people who are doing catering were wondering if we could get out and pick tea, and then we do the Q&A after that. But I'm open to suggestions.
Your voice is too low. I can't hear you well.
To break for tea right now, and then we do the Q&A after that.
All right, no problem.
Okay, so can we use the 20 minutes? It's outside.
Just a quick one. For the people filling out the informed consent, let's not try to talk of them, but also you see your identification is not needed on the top of the consent form. But remember to fill out the statement of consent and also you sign off.
Yes, sir. How was the presentation? Actually, didn't see anyone. How was the presentation? Did you actually see the students see or they didn't see anyone?
Yes,
excuse me, if you've just come in, you wait to complete the informed consent and the pretest. Please don't. The participants registering, I mean, if you're coming at this point, you can take the informed consent and the pretest, but you're not going to fill it out at this point, right? Yes, fill the paper to register, pick the informed consent and the pretest, but you're not filling them out at this point. So, because you cannot complete what you don't know, we shall have a debrief, a session. You can wait in the back. You can wait in the back pews, and then we are going to run you through the informed consent and the pretest, but feel the comfort to make your registration. You can also grab a bite from, there is a serving point outside here.
Facebook Brightness.
Let us kindly finalize with our breakfast. There are some of your colleagues who would like to run into another exam, I think, this afternoon. So, if you're just coming in now and you've received a consent and a questionnaire, please just sit at the back, first way to fill it out till when we have really talked into those documents. For the team that is registering now, please take your consent and the pre-test, but don't fill them out. How many of us are rushing out for exams? Someone told me they're having an exam this afternoon. Was it an exam or another appointment? Yes. Which is that? A test, yes. Oh, there is a difference, so I thought they were the same. How many are rushing out for a test this afternoon? Will you be in position to return? or you can make it tomorrow? Yeah, because we have two components that are remaining. One, the Bristol exam that's going to happen now about this time. Then the post-test which can come in a month's time. So this is the next part of the procedures. If you can't wait, you can still go do your test. Then either later in the day or tomorrow, you can come and have that component. Is that fine by us? Yeah, you can still go and do your test. Then tomorrow or later in the day, you can come and have this. Otherwise, the consent will not have been completed if we don't do the self-examination. So surely, feel free to go and attend to your test.
I rank, I took yes, but it was set completely present.
One last caution: the people who are receiving informed consents, registering about this time now, and taking a pre-test, please, you can go and see it, but don't complete any of those documents. So ideally what should happen is that when I come in, I get the informed consent, I get the pre-test. So as a researcher, I'm supposed to let you know why you're taking that informed consent and why you're taking the pre-test, and also to have that kind of presentation which we had. So don't fill them out. Let us also take you through the sessions just like we did for the team that came through earlier. I've observed that most of the about the last 15 participants that filled out the informed consent didn't do it right. And in any case, it's expected because you've known what we're consenting to. You hadn't gotten the information, you didn't have any knowledge whatsoever about the pre-test. So kindly bear with us. Sit somewhere as this group that has been here since morning takes the intervention, then we shall also come back to you. You can, in the meantime, grab a snack and we shall be there.
슈플이 내려 있습니다. 네.
Good afternoon. We are suggesting that those who have just come in and need to do the pretest to the other column so that we don't. So this is not an exam, so don't feel pressured to find the right answer. So just answer what you know or what you practice, what you do. Don't, let's not go to Google. He is our friend, but not this time. Let's not Google, please. Thank you.
kiri deh, saya ke kiri. Enggak. Nabi.
Welcome back from the break. So for the newcomers, as we have said, we are going to wait for our next session as the people that have been around get into the practical session. So if you're just coming, Dr. Harriet is going to take us through a informed consent, and we shall have a pre-test and also have the theory from Grace. Then we'll also get into this session. Thank you so much for being patient with us, but we should be done. For the teams that are going for your tests this afternoon, please excuse yourself, and when you're done, you can have this session tomorrow. Is that agreeable to all of us? Yeah, thank you. So I think we are going to have our presenter return and respond to the 4 questions that were asked, and then we proceed accordingly. But people, the newcomers, please have a copy of your consent, have a copy of your pre-test, but at this point, please don't fill it out, because you have to first get information about the intention of those 2 documents that you have. Make sure, even if you're excusing yourself, you complete all the study-related procedures. And that is having the informed consent completed, then having the pre-test, then the theory that Grace will be presenting again, and also the practical test or the self-paced examination. And after that, we shall have our post-test in a month or 2. But let's first have all this done.
Good afternoon once again. The people who have moved the first time, or I don't know how many times you've already moved. I'm going to suggest that we move to another room so that we handle you there, which is level 3. Level 3. So that this group continues through the process. Because you're at different steps or levels. When you finish, you'll be coming back. So she's going to guide you where that is.
And to be specific, that if your consent form is not yet here, that's the group we are talking about. The people who have just come in. You have your consent form in your hands, you have the pre-test, but we want to really tell you what the exercise is about and to really know what you're consenting to. So basically that's what's going to happen. So after the presentation, you will also come and do the breast examination when your colleagues are done. We do apologize for the inconvenience. Only those that have just come in. If you've been around since morning, you already did your consent form, you are taken through the consent form, please stay behind.
Dr. Florence, you're most welcome.
Thank you, Dr. Khadija.
Thank you. We already started earlier. We had our first session. We are moving to the next session. Unfortunately, participants standing late. We had our first session, which was filling in form. The second session was having a pre-test. Then we had our theory part training regarding breast cancer examination. Now the second group is joining for the same process. So we are glad to have you here, and we hope you will enjoy the training for breast cancer examination.
Thank you, thank you.
Hello? Grace. Grace.
Dr. Harriet?
Yeah.
Yes, I can hear you now. Maybe a bit louder.
you wanted to respond to a few comments that were, questions that were raised. Can you just do that in a few?
Yes, I remember the first question. Someone wanted to find out whether having eczema exposes one to breast cancer.
Yes, go ahead and answer that.
Yes, actually no, from their healthcare provider. But there is no research that is actually backing up the fact that skin conditions exposes one to breast cancer.
Okay, thank you. Is that all you had? There was a question around blisters under the breast.
What was the question once again, Dr. Harris?
Causes of blisters under the breast.
Causes of blisters under the breast.
And then the second question you can add to that is the texture of the lump they are looking for. They needed more explanation on that.
Okay, firstly, with that question regarding the blisters under the breast, like we mentioned, if anything is observed during inspection part, that there are changes in the skin color, texture, and contour, it has to be regarded as abnormal. And that's why you have to immediately seek for help from your healthcare provider, from your doctor health country. You can go to your hospital. If you're at Makerere University, like I mentioned, the university hospital will be very ready help. So anything abnormal, any changes in the breast, because the breast, like we saw the normal findings, there shouldn't be changes in the skin color, in the texture. That means there is no wound, no blisters, no skin color changes. So anything variating to normal, variating from normal should be regarded as abnormal. So you have to seek for help. That means we look at the different types of breast cancer, and inflammatory breast cancer can also bring changes in the skin color and also changes on the skin texture. So all these abnormalities have to be regarded as danger signs, and they have to be taken into consideration. So regarding the second question, which is about the type of bumps. So we talked about palpation part, and we said anything that is felt during the palpation part that is like a bump or a nodule should be taken for further investigations. Like we said, they can be cancerous, they can be cancerous tumors or benign tumors. Benign tumors can also be felt as lumps or bumps, or masses. So they have to be confirmed with other further investigations as clinical breast exam, as we mentioned. They can do an ultrasound scan for the breast as well as a mammography to identify and clearly categorize the type of tumor or the type of mass that has been identified.
Thank you.
Any other question?
Yes, there is a question. Is breast cancer hereditary?
Okay, maybe the person asking this question wasn't in our theoretical part or the training we did this morning. We mentioned that there are many causes or predisposing factors to breast cancer, and we say one of them is hereditary. So if members of the family have breast cancer, this can be transferred to the generation or to relatives, especially from aunties or first family members. Those are parents and grandparents. So this has to be taken into consideration, and we say this is there is someone having, if a family is having a BRCA1 and BRCA2 mutations, gene mutations, they can transfer these abnormal mutations to anybody in their family, and this is a very high risk to developing breast cancer.
Okay, thank you.
They will get more information in our next session.
Grace, thank you.
We're going to repeat the entire session. I don't know whether we are ready now so that we can again go through our next session.
No, we are not. We have separated the group, and that group is in another room. And in this particular room, we want to go to the second session, which is demonstration. And we are going to do a group demonstration, and then the practical. That's when we shall split for them to do the practical. So over to you.
Thank you for answering those questions from the group. Right now, as Grace was presenting, she talks about two methods of doing breast self-examination. The first one was, what was the first one? Can I see a hand of the person who was so attentive? Yes? Thank you. The first one is inspection. So right now we are going to look at the inspection, and the second one was palpation. Thank you. So I'm going to demonstrate the inspection part of it. After having this general inspection demonstration, you'll again break yourselves into smaller groups, and you'll have like different points. There is this point, there is that point, and there will be another point here. So those are 3 points. I think the third point might be there. So there will be 3 points. You'll break yourselves and identify a point where to be for the palpation part of it. Then after palpation, each of you will go into those screens. It's better to go alone because of issues of privacy, where you're going to demonstrate, as in do the inspection and palpation on yourself. Okay? Then when you're done, you get out. The reason as to why we have put screens is we want privacy, we want you to be alone there. So in case of any findings, you'll come and inform us, but we want you to do the demonstration yourself in that curtain inside there. Are we together? Yes. Okay. So right now, we are doing the inspection part of it, and the first part of inspection is observing. Okay? I don't know whether, I think I'm loud enough. So what we are going to do in inspection, the first part is we have a mirror. I have it here. So we said that the best place to do this examination is our bathrooms, isn't it? From the presentation, in your bathrooms is the best time. You go to your bathroom, and most of the bathrooms, I think even your bathrooms have mirrors there, isn't it? So go to the bathroom and face a mirror. Make sure that there is a mirror. I have mirrors there, but I have a mirror, okay? So the first thing I do is to just go in the mirror and look at myself. Okay, look at the breast, look at myself, look at the breast. And what am I looking for in the mirror?
The shape of the breast.
Thank you, the shape of the breast. We have seen the normal shape and the shape which is not normal, is it? So the shape of the breast. Is it round? Is it, what is the shape of the breast? What else do we look out for? The size. Okay. What else? We look at the size. What else? The color. Thank you. Especially the color of the areola. Good. What of the nipple? Thank you. First of all, is it there? Look at the nipple. Do we have a nipple or we don't have? Is it inverted or it is inverted? That means it's pointing out or pointing in. Okay? What else do we look at? The skin of the breast. Okay? What are we looking out for? The color. There's something called orange peel appearance. Like you see an orange has those dots. So we look out for that. So basically when we face the mirror, let us look at the breast. Are they there first of all? We have both breasts there. 2, the color of the breast. Is it uniform? Are we having one breast darker than the other? Are we having one breast red than the other? 3, look at the nipples and the areola. Are they there? How are they presenting? Okay? So all that we are looking, just watching the breast before doing anything else. Okay? So after we have looked at the breast, what is the next step? Okay? We have looked at the breast. The next step is raise your hands. And as you raise your hand, you still look at your breast in the mirror. Are they moving at the same pace? Are we having, when we talk of symmetry, are we having the same? Is the right the same as the left? So many people always say that sometimes one of the side is smaller or bigger, but the difference is not so visible. The difference is really not so visible. But if you really see a visible difference, then that's where there's an issue. So as you're raising your hands up, we always want to raise the hand up. As you're raising up, you're looking at how the breast is moving with the movement of your hands up. Are they moving at the same time? If they're not moving at the same time, it means there's something pulling the other one that is not moving at the same time with this one. It means could be there's a lamp which is holding, because of gravity, it is holding and making seeing that the other one is lagging down as this one moves up. So that is another technique, just putting up as you're observing in the mirror. Okay? The third one, what is the third one? So that is, we are looking at how the breast is moving. Are they moving the same way? Are they having an issue and all that? Okay? Then the third step, we could also just hold the waist like this and also observe. Are we having symmetry in the movement? Okay? Are we having symmetry? And as when we hold here, we can also bend a bit. And when you bend, you also see the shape. The shape. Sometimes, of course, if you find that one is higher
And make sure the camera is facing
Will it be possible? Maybe. Okay. Okay, let's try to do that. So on each point, make sure you observe the circular assessment, the circular palpation, the weight, and the linear one. Okay? Okay, can we have the first group here so that we demonstrate as we are putting the camera to see this, then the others can join the other groups. So those who are not camera shy,
now, but we're not looking at the person demonstrating for us to
a small announcement. This dam is soft, so as you're demonstrating, make sure you don't poke them. Because when you poke them, you're damaging them. They are not these hard damage. I don't need gloves. I'm going to use their hands. I don't see the reason as why someone has to use for gloves. So we are going to do a demonstration. I have finished the now it's like to start with the axilla area. Those notes are the axilla area. So my pattern always starts from the axilla area as I go downwards. So the first part of it, can I have someone there? So the first part of it, even when you're going to do inspection, look at the female. If you're going to also do the inspection, you could be standing up, you could be lying down, you could be sitting. And also just look at the symmetry. First, start a quick one. So our breasts here are symmetrical, and we are going to first start with the circular one. Okay. So with the circular one, we say we support the breast that we are examining, and I said we would want to always start from the axilla area. Reason being that we have lymph nodes here, and in most cases when we are having any lump and what, these are the points they always want to attach to. Okay. So it would be good to start from the axilla area. And when you're palpating, you see the circular, you see the like, I'm doing like this. When you do like this kind of movement, like your kind of massaging, but a firm massage. It's not just a massaging in the body, a firm massage. This helps you to, we have serious senses here at this part, we have senses there. So we are able to pick anything that is abnormal, any lump, and not only that, as we are doing that, we want to understand, is this swelling movable, as it can it move, or is it firm, fixed? Okay, that's why you see we do that kind of motion. So we support the breast, we start from here and then we go down. Okay, you see how I'm doing it. Like I'm supporting it and then I'm going This is circular. I'm moving in a circular motion. Moving in a circular motion. Okay. And after that, when I'm done with my circular motion, I end with a nipple. And with a nipple, I hold it like this and press. Why do I have to press a nipple? You see whether it's discharge, either milk, water, or all those. If it's milk and the person is breastfeeding, that is okay. But if I'm not breastfeeding, then I'll start putting question marks. Okay? So that is with one breast. Then you come to the next breast, and you also do the same from the axilla side while supporting the breast. Okay? From the axilla side, and then you do the circular kind of motion, the circular motion. With that kind of motion, you're able to understand, is there a lump? That is the first thing. You're able to pick any lump, any swelling, any lump if it is there, and then you're able to understand whether it's fixed or moving. Okay? Yes, there's a question there. So you just hold like this and then we're moving in that circular motion. Okay? And when you reach the nipple, okay? Always start from that. Okay?
Sometimes you have talked. Thank you. Sometimes you have talked about having blood discharge, water discharge, and milk discharge. But sometimes where patients come in, they are breastfeeding and they're having a pus-like discharge. So sometimes mothers mistake it like to be milk, but it is a pus kind of discharge. It's an inflammatory kind of process that is happening, and they ignore it to be like maybe it's milk. Some people do it.
So you should not ignore, actually, as you're teaching maybe your the mothers, as you're teaching your colleagues, even you yourself, anything that is not milk for someone who is breastfeeding. So any other discharge is not normal. Because even right now, if you're not breastfeeding, if you breast, there is no discharge that is supposed to come out. But if it comes out, then you start thinking otherwise. Okay? So even though it's past, it's not normal. It's not normal discharge. It's not supposed to be there. Probably there could be a swelling inside that is causing that pass.
Then I had a question. Small, like I had them talking about if someone is pregnant, it reaches I don't know which stage of pregnancy, whereby they press their nipple, they have water discharge from the breast.
And that's why we were saying that if you're not breastfeeding or like in the pregnancy breastfeeding state, start producing milk as months. Okay? Yes, 5 months pregnant, they start producing breast milk because the system is already. So if you know that you're not in that category, you're not breastfeeding, you're not pregnant, you wouldn't want to see any discharge. Okay?
My question is, isn't the breast is not supposed to have anything hard in it?
Mm-hmm. Yeah. Wasn't it answered? Breast? No, it was answered. What did they tell you? What did they tell you? Answer her. Can you please answer her? The question was like, repeat your question and your colleagues answer you.
The breast, is the breast supposed to have, like, it's not supposed to have anything hard in it?
It's not.
Because the breast is a soft tissue, so you don't expect anything hard in it.
Actually, that's fat tissue.
Fat tissue. So anything hard is
abnormal.
Yes.
So my question is, you see like the nipple peeling off?
Yes, and we say it's also not okay. It's abnormal. The nipple should not bleed. And also, sometimes it bleeds, and then there is even sores on the nipple. Then that is something you need to report. Yes, it could be that you're having maybe a skin reaction and all that. I had a hand here before you.
Okay, yeah, when I encountered a baby whose nipple was producing a watery liquid, what could you say about that?
Then the mother has to take the baby to the hospital. Because we would expect that.
I'd like to ask a question. Did you have something brown, like a ball,
something that feels hard? Especially during when you're soon going into your period. Yeah, that one is okay. That's normal. That is what you were asking. That is okay. That's why we always talk about knowing your menstrual cycle. Knowing your menstrual cycle. Sometimes some of those things you experience them when you're going into ovulation and your menses, your menstrual period. That's where you find some of these changes. Some people will complain of some tingling pain, some pain sensation. But you need to understand it. Is it always there? Or it is throughout? Is it there throughout? Or it is only at that time when you're soon going into your menstrual period? Yeah, sometimes it's before or immediately after. So that's why we say that doing a self-breast exam also helps you to understand your body, to understand your cycle, your body, and all that. Okay, and your reproductive cycle. Okay.
Excuse me.
I think we need. Okay.
Yeah, it's in the same way that you said that when you're doing palpation, and encounter something which can be relieved or vexing. So should I take it instead of It's the normal thing we've been talking about towards periods.
That's what I'm talking about. Understand your cycle. When do you start feeling this kind of something that you're feeling inside there? At what point? Is it there throughout the month, or is it there at a specific time? And if it is at a specific time, how does it behave? So if it is a specific time, then after that it goes, that is okay. Okay, but if it is there throughout, then you start thinking otherwise. Then you're also talking about, is it fixed or is it mobile? That also tells you something. First of all, is it there throughout the month? Is it fixed? Is it mobile? All those are issues that you need to raise. You don't ignore them. Let's have the last question and then we continue.
Okay, thank you. Mine is, what makes some people to have like black spots around the nipple, then some have like they are brown, they are not black like others.
I think that was talked about. Yeah, skin tone. Skin tone. Others have lighter skin on the nipple, others it's skin tone, varying from brown, even others red, to black, to darker shade. Others pink, yes. The whites have pink. For us, if we see brown and all, that is okay for us. Okay. Then light people, those who are very light, they have brown, pinkish. Okay. So the color has no issue. It's the color. If it's not, I think the color you need to look at your skin color and then vis-a-vis the color of the leather. Okay. Then if there are swellings, that is when we shall start putting question marks. Why are we having swellings? What is happening to those swellings? Are they itchy? Are they producing any substance? Are they, even the smell, is there a foul smell? Then that means there's an issue, maybe an infection at your areola.
Lillian, I wanted to comment on her color question. If pregnancy will change the color of the breast, so if somebody has conceived, it will darken more than it was usually.
Okay. Thank you. Yeah, when you're pregnant, there are those changes.
Yeah, I'm just asking when it comes to the cases of bras images where that the doctor didn't comment on that, but I just wanted to find out because I meant that written somewhere that during these high temperatures we should avoid bras that are black and we should not wear them most. I don't know what the difference is about that.
Bras and the breast. In most cases, we don't want tight-fitting bras because we need circulation. Circulation, tight-fitting, like keeps the moisture there. It's not also good for your health. Tight ones, we want to avoid constricting our nipples, our blood supply, and all that. So that's why, if possible, get the right-fitting bra. There are these ones who want people. They avoid what people. Yeah, in most cases, you find those are tight bras. Okay, so put on a fitting bra that fits you properly, and the one that is not tight to constrict you, and at least will give you space. If it's tight, you really feel so constricted, isn't it? It also affects your health, your circulation. Okay. So I think we end there. Other questions will come as we go to the other part of it. So what we have just seen is the circular. So let us do the linear, okay? So the linear, as I said, my starting point is at the axilla area. Those are the axilla lymph nodes. Okay. So with this one, we also support your breast and also start at the. It's still the same motion. You see, I also do the same motion while I'm coming down. I'm supporting the breast, okay? Especially there's some of us who already have children who have already breastfed. You find that our breasts are not firm, so we really need to support it as we are doing this kind of. So you see how I'm doing it? And I try to go up a bit high so that I also target the lymph nodes that are at the clavicle area. Okay, so I go also a bit up and then, so you see how I'm targeting both the lymph nodes that are upper clavicular and lower clavicular. Okay, then I also come back. So you see the motion. So with this, you're very sure that you're not missing any point. You're very sure that you're not missing any point. No. That's why I have told you that as you're doing a breast exam, you appreciate your body. You realize that your body is just not an instrument, so you handle it with care. The breast is precious, thank you. Now with this one, this is a dummy. So someone will come and feel this. There is a lamp here, okay? And you can feel it. So you go, let me first finish. So I was able to pick that lamp. These are dummies for exam, student exam. So that can be an exam to see whether someone is able to identify a lamp. So you come and identify that. So I also go to the next breast and do the same, right from the axilla area. I come down. Because we still need to use it. If your colleagues were pinching it, you would not have it right now. You would not have anything to use. So I expected someone to ask me that, what about at the nipple? You realize as we were coming down, we also came across the nipple.
Yeah.
So when you reach that nipple, this is the time you can press. Then you continue down. That is the linear part of it. So you see what we were talking about? On inspection, if you see something like this on the skin, those are the things we look out for. You see there is is it a swelling or a depression?
If it's just like a wound.
Yes, even if it's a wound, it's not supposed to be there. It could be indicating something, either an infection or anything. So anything on the skin which is not supposed to be there, it's something to get worried about. So as we were inspecting, we didn't see this, now we are seeing it. So what would you do here? Thank you. Run to the hospital and discuss that with your doctor. Okay? Mm-hmm. Okay, can you feel that? Can someone demonstrate that linear? Only one person. And tell us what you have, your findings. I need one person. Okay. The whole support.
Start from. Imagine it was you doing it.
Okay. Imagine it's your breast.
Are you pressing it for me?
You need to have like a continuous motion, because if it's not continuous, you will skip some points. Okay? You look at how I do it. You see? You see? I don't skip. Because if you skip, meaning you're going to miss some points. You see how I move? You just move through. You don't do this. Okay? You do it and we see. Imagine it's your breast. Like it's your breast. Skipped here. Like this. You're skipping, you need to move smoothly through. No, 4. You use all the 4. Okay. You don't skip any. That means you. No. When you said when you reach the nipple, we press and then you continue. Up, move up. We are targeting the lymph nodes at the clavicle area. Upper clavicular and lower clavicular, okay? Move. And it has to be a firm press. That's what I want you to see, whether you're able to feel that. If you're able to feel that, it means you're doing the right technique of palpating. If you're not able to feel that, it means you're not doing it right. No, you shall do that. Okay, I just wanted to give one person that chance to demonstrate that, to feel that. Okay, so we can go to the next one. Okay, we can go to the next one. Which one is the next technique? The wedge. Okay, I'll give each of you a chance. Whoever finishes goes to the curtain and does self-exam. Okay, so I'll give each of you a chance to demonstrate from here. Can someone hold for me? So we are going to do the wedge. Okay. Where do I start from? Axilla. So axilla. The way we move towards the nipple. Okay. You see, I don't remove my hand, my fingers from the breast. While supporting your breast. point I can also press my nipple. So when I reach at the upper side here, I always go past because I'm aiming at the lymph nodes that below the clavicle and above the clavicle. It can be if it is advanced stage. But the ones that are targeted mostly are the axilla and the clavicle. But it can go up to the cervical. But once you catch them here, these are the most, the axilla and the clavicular area, and the lymph nodes that are always first to be affected. Any question? So those are the three techniques for palpation. We say the first one is circular, the second linear, the wedge, and we have done all of them. Okay, so you do both. Whatever you do on the right breast, you do it also on the left breast. Don't say, I've changed one breast, okay, no, you have to do both. Whether you're okay or not, both breasts have to be attended to. Okay? So, any questions? Yes, sir.
Thank you, madam. Am I supposed to do all my techniques at once, or I can decide to do all the circular without the two breasts or wedge?
Thank you for that question. The reason as to why we are teaching you all these techniques, sometimes you might find maybe you're more comfortable with one method, and that one method you're able to cover the whole breast, so it is enough. However, sometimes you want to really be, if you have like enough time, you want to really understand whether you have covered the whole breast, so you want to do another method, but one method is enough. As long as you're very sure that you have covered the whole breast. And that's why I was talking about the starting point always. Try to always start at the axilla area. Axilla is under the armpits. That is actually when you touch at the armpit there, you feel something like hard, kind of like a hard, something hard. So that is the point we are talking about. So it's kind of like a muscle, kind of like this. So you find the lymph nodes are attached on that segment. So you go down and then you go downwards. So as you're palpating, and what are you looking out for as you're palpating? Lumps, what else? Masses, what else? Someone saying it here. Discharge, what else? Someone is saying it, and she's saying it so low. Who is that? It's the right answer. Pain. Okay, it shouldn't be painful. Even though you're really applying a really firm touch, it's not supposed to be painful. It's painless. Okay?
Is it a must for every lamp to create that hole?
No, it's not a must. She's saying that is it a must for every lamp to present with this hole? No. Some lamps will not, especially those that are mobile, those that are moving, they don't create this hole. The one that creates this hole in most cases is the fixed one, because it's occupying that space. But the one which is not fixed, it's not supposed to make that hole. Okay? So we can have people demonstrate and then we go and eat.
So in other words, you cannot just grab the whole breast and press it at once.
You will not have attended to all points of the breast. Our main aim for doing that, for making sure that we are doing all these techniques, is to make sure that we attend to all points of the breast. Nothing left. And even you saw the technique of palpating. It is kind of like you don't skip. You have to be continuous. Okay? You don't skip. And when you do like this, you're covering a bigger part other than just doing like this. It's different. This and this is different. When you do like this kind of circular motion in your palpating, you're able, one, to cover a larger place, two, you're able to go deeper to understand what is happening under there. But when you do like this, you soak much of the surface. Okay, so the technique matters a lot, the technique you use. Okay, the breast is there for you. You can do two people, one person can be another one here, and then you go to the screen. I just want to observe as you're doing it, and I'll tell you whether you're doing right or not, you're doing well. Where did we say we start from? The axilla, your partner. We said the axilla is always the best to start from there. So when we're saying support, this is what we talk of support, you know. This is support. I can support my breast and then be able to palpate. Powder, don't mind, this is powder, you know, this is like skin. If it is over touched and all that, it becomes so soft. So this is powder. Have you felt what we are feeling? Okay. There's nothing you're going to learn when you do this. We use the fork. So if you're done, another person can come, and then you can go and use the screen. For me, I'm here to just observe and correct you. I'll observe from far and correct you.
Which one? Which method are you using? That's what you have been teaching. Were you in this book? Just what we are doing. What we do, what is that's why this is techniques are best, so that you'll be able to know so your aim is to make sure that all the points of interest here you will attend. There's nothing to
We're supposed to do 3 fingers before.
Which one is short foot hand?
So you can do all the techniques that
Let's not forget the post-test. Immediately you're done with the self-exam, then you proceed with the post-test.
kindly make sure you don't drop the food down. That's why we have given you a tray, so that we leave this place clean. The note that has just finished the practical part of it, after your lunch, you'll go to room 3005 for your post-test and your facilitation.
So the second group, after you pick your meal, you can join this auditorium, then we get into the next session. For the people who have finished the exam, we are moving up. You have your lunch, then we move up for the post-test. Don't miss any part of the study procedures, please. I see some fellows from the previous group still here. You're just having lunch, or you would like to get into the study a second time? You want to do it again? No. Let's give a chance to other participants too. For the second group, we have not yet reached to this level. We are going to go through the procedures. I know you have copies of your informed consent. We need to take you through the informed consent. You do the pre-test. We shall clearly instruct you what to write on the pre-test. Your initials, your course may be and whole of residence. And then after that, we shall get into the demonstrations. For all who are in group 1 and you're through, kindly move to room 3005, where you do your post-test and also receive your compensation for the time and effort. Thank you. Let's register well. I see people writing MOOC. What does MOOC stand for? Which one? They changed, right? I don't think it's MOOC, because Moi University in Kenya also uses MOOC. So it's marked, right? Yeah, okay. But I've seen quite a number of as we decided that more. I thought it had changed. Group 2, let's get done with our lunch, then we get started. Group 1, please give a chance to Group 2. Anyone wasn't from Group 1? Anyone wasn't done a self-exam? You have the time.
It's very important for you guys. You never know, you may meet something and of which, if at all you identify anything deviating from the normal, when they get assistance, or you will be able to know what is happening to your body. Don't miss.
Let's ensure that we go through all the study procedures. Otherwise, if you miss one part of the study procedure, it seems the implication is that you don't really participated in the study.
that, I would get and they are not ones who are doing the test and they are like the cheaters. After all the answers and you get them.
For anyone moved to a consent form, I don't know whether you are picking your consents, but some of them were signed. Please, yes, return the consents. Make sure you have a plain consent form because Dr. Harriet is going to take us through the informed consent, and also I've realized quite a number of us have not put your initials for your name, the whole of residence, and the course on your pre-test. So for group 2, we shouldn't be doing this since we are starting off at the same time. Group 1 is understandable, some people came in late, but we don't want also any of our instrumental tools to be validated when they need some critical information. Make sure your pre-test has your initials, and these initials represent your college or course. They represent your name and also your hall of residence. Then for the informed consent, you don't need to write on top of it, but make sure you sign it off with your names and signature and the date, and also you acknowledge that statement of consent that you received this information from Dr. Harriet Barry. Voluntarily accepted to participate. So we are going to copies of the informed consent. One is for our record or for the researcher, and one you can retain it if you wish so. Thank you. So for the group 1, you will move with Dr. Ivan to room 3005. And he will be taking you through the post-test. Group 1. Group 1, if you're through with your self-exam, let's move to 3005. And at this point, I'm also going to invite Dr. Harriet to now take us through the informed consent, then the pre-test guidance, and also we hearing from the researcher on the theoretical component before we get into the real practical experience. And after the practical experience, we have our post-test and also sign out for our compensation. Thank you so much.
Good afternoon. I am hoping you have your consent forms. So, consent form is a document that has to be signed, and so you'll be able to put your name and signature and date on it. Okay. So, the title of the study, I'm just going to go through it quickly. The study title is The Impact of Education and Educational Intervention on Breast Self-Examination as a Screening Strategy for Breast Cancer Among University students in Uganda. So Grace Ohanji is the PI, and the co-PI is Professor Dr. Shofas. They are from the same university. University of West Wales University in Münster, Germany. Okay, so who is the sponsor? So Grace is sponsoring this study. The purpose is for us to assess the education sessions that we are giving you as an intervention evaluation of self-breast examination to promote a health behavior change among university students. The study involves educating you on the procedures, and then after a few months, 2 or 3, we will ask you questions to see if you learned and if you're practicing what you learned. So we are saying that today we are going to pick data from you. We'll give you a pre-test and then a post-test. But a pre-test just means a test before you do the session, education session. And then the post-test is another test that you're going to do after the session, the teaching session. So we don't expect that you Google, because we want you to tell us what you're practicing and what you know currently. Then after we teach you, you tell us if you answer that form to see, we see if you gain more knowledge or not. Okay, so this is a pre and post, like I've said, study, and we want students who are between 18 and 35. We want students who are coming from Mary Stuart's complex and Africa, the 3 halls. Okay, so what are the risk factors? So if you're a medical student or a student offering science courses, you don't qualify to be part of this study, because so if you're offering nursing, medicine, dentistry, those things, we will ask to excuse you not to do that test. You can listen to the education session, but we won't be requiring you to do that test. So what are the risks? We don't think that there are many risks. But probably a bit of anxiety, might feel a bit of anxiety while you're assessing yourself. But that is normal, that's normal anxiety. We will support you, but if you feel uncomfortable, or the doctors or the university hospital will be there for you to go and do either a mammogram for you to confirm your suspicions. So what are the benefits? The benefits is the knowledge you will gain as a person and the skill to be able to conduct the self-breast exam. We will handle your information in a confidential manner, meaning we are not going to have your names written on the test forms, the pre-test and the post-test. We shall use codes which I'll let you know. So that's how we are going to keep your information confidential. This won't cost you, but you'll be refunded for your time, 15,000 shillings. If you have questions, you can raise them to Express or me. And then I have a statement of voluntariness. This study is voluntary. You're not forced or forced. So if you agree to be in it, you will have to sign at the back, on the first line, your name and signature and today's date. So if you have the post-test or the pre-test, you write on it. I'm going to tell you how to code it. So you write your initials. If you're like me, Harriet Babikako, it will be HB dash the year of study. I'm assuming I'm in year 5, so I'll write 5 using the Roman numeral. Then if I'm Mary Stuart, I'll write MS dash. If I'm offering MBCHB, then I'll write it there, MBCHB. So it's HB dash I dash MS dash PCHP. That is how you're going to codify the pre-test. The code, initials, year of study, hall of residence, program.
the consents, you did the pre-test, you went through the demonstration, you did self-breast examination, the mirrors, these 3-4 points you see. Afterwards, you want our papers here, you should be up in room 3005 at level 3. Are we together? Apart from the new ones, you can be with your pre-tests. Hope you finish them, finish filling them, and concentrate.
make sure you have a pre-test and you're filling it. There are those who had just come and only picked consent forms. Please pick a pre-test.